campers. Are you guys having a great week or what? Thanks for joining me today for massage and acupuncture. I am going to talk to you about the benefits of both and some of the oils that you can use and why you want to incorporate these into your lifestyle. So before we get started, let me introduce myself. I am Heather, and um, I'm a God lover. I am a wife, a mother of 2 small kids. I have a private practice here in Bozeman, Montana, and I have been using holistic healthcare for about 28 years, and I've been in the spa and wellness industry for 16 years. So I hope that you get a little bit of benefit from what I'm about to share with you today. So let's get started. Massage. Okay, you kind of know. Obviously, massage is helpful in reducing muscle pain and tension. It also helps to bring down your stress, lower your blood pressure. And it does all this because it activates your parasympathetic nervous system. So that's your rest and relaxation state. It also increases blood flow into the tissue. So blood flow is important because it increases oxygen, or it carries oxygen and nutrients into the tissue. It creates this healing. Massage helps to remove some lactic acid buildup and to reduce toxins, which is why your massage therapist is always telling you to drink water to get those toxins out of your system. Massage can also be really beneficial for overuse injuries. So something like sports or at work or something you're doing at home. It's also really preventative for those injuries as well. It's good for pregnancy discomfort and postpartum recovery. But did you know that massage therapy can also help with digestive disorders, anxiety, fibromyalgia, migraines, headache pain, insomnia, if you have stress-induced insomnia, myofascial pain syndrome, thoracic outlet syndrome, TMJ, carpal tunnel, any kind of car accident, if you are going through chemotherapy or have had radiation with your doctor's approval, of course. It also is really good for if you had emotional injury. So anytime there's an emotional injury or emotional trauma, there's going to be a physical response. And it's these physical responses that over time can lead to chronic pain or disorders. So it's really important to get massage as well as some other avenues like acupuncture or PT to get to help retrain those neural pathways. So all these benefits of massage, right? Don't you want to incorporate it? Yes, of course. You should be incorporating massage into your budget so that it's a preventative health. It's also very anti-aging practice. So everybody should be getting massage, right? But let's talk about some essential oils that are good to use during massage. One of my favorites is basil, which is fantastic for softening the tissue and releasing some of those knots that you get in the back of your neck and in between the shoulder blades. So basil is really great for muscle tension and chronic muscle tension. Lemongrass is another favorite one. Lemongrass is good for all connective tissue. It's also really good for any kind of swelling to help get rid of some of the fluid in the tissue. Aroma Touch, which is actually your massage blend, and it has a lot of the oils I'm going to talk about in that blend. And that's a really good one to use just anywhere nightly if you want to do some massaging at home. It's great if you have some hyperactivity muscles, if you have spasmodic muscles at night, tingling things like that. Lavender and the Aroma Touch are really good to help ease those sensations. Marjoram is another one. Marjoram is really good for muscle tension and muscle pain. Frankincense, which is really meditative and calming, also has a lot of anti-inflammatory properties to it. When you combine marjoram and frankincense together, then you have this really fantastic thorough pain relief blend. So that's really great for pain, just deep pain relief. Peppermint is a great one. It's very cooling to the muscles. It's great if you have that head tension, especially the sun. When I'm in the sun all day, that'll give me headaches. So peppermint's going to be really cooling to the body, bring down those temperatures, take the heat out of the muscles, and really relieve some of that tension. You can even just rub it into your scalp, put it along the hairline. Just be careful not to get it too close to your eyes because it will make your eyes water. So really side note here. On vacation, I carry frankincense with me. I put it on my skin several times a week, and I reached into my bag. My husband had it in there, and I didn't even look at the bottle. And I put a couple drops in my hand, and I just lathered it all over my face, and it was peppermint oil. And I couldn't see for 15 minutes. My eyes were watering so badly. So please look at your bottles. Balance is another oil that is really good for a massage. It's very calming. It very brings you back into yourself. And then we have Deep Blue, which is a soothing blend. It has a lot of cooling essential oils to it. It's going to have pain relief. It's also going to have anti-inflammatory responses with the combination. And then there's 3 different ways that the Deep Blue comes. So you can get it in a Deep Blue rub tube, and then you also have the 5 milliliter bottle of Deep Blue, or you can get the 10 ml of Deep Blue in a roller bottle, which is really great at night because then you can just rub it on in your sleep and not worry about your hands or anything like that. So that's from a client's perspective. Now, from the practitioner's perspective, I'm going to add a couple oils that if you're a massage therapist and you really want to incorporate aromatherapy into your practice, then you use definitely all the oils I mentioned before, but you can add a couple. Like my 3 favorites would be On Guard, Breathe, and Lavender. So On Guard, you are not going to use on your clients. However, you are going to you can make a hand sanitizer and put it in next to where your clients address, and that encourage them to sanitize their hands to reduce pathogens in the office. You also can use a diffuser, which is really great in the winter months because it has that nice spicy warming smell to it. So your clients are going to have this amazing atmosphere on top of their amazing aromatherapy massage. Breathe is another one. You can add the Breathe into your palm or your massage medium, put it on the chest, on the back. It's really great when you flip your client over after they've been in that face cradle and they've had that pressure on their sinus. Just have a little breathe, have them inhale. Your clients will love you, and you will have the most amazing client retention because of it, because they are all having that relaxing oils. Not only they're going to leave your practice loosey-goosey and feeling good, and they're going to be breathing better. So trust me, your retention rate will increase with aromatherapy. Lavender is also good for relaxing and calming. If you have a client that is rushing around, that comes in, because they were 15 minutes and halfway across town and they had to drive at like 75 miles per hour to get to you, and they had every red light and they had the slowest person ever behind them, and they come in, they're all angst and and if that's you, then pull your balance out of your bag and inhale that. If that's your client, you put that balance on their spine and have them and hold them for a second, palms down, and just have them come into themselves. Now, when you have balance, I'm sure that you all have it in your bag. Everybody carries balance with them, right? So you have your balance. It's going to help increase the benefits of massage. So you want to always have your balance with you when you go into a treatment. And please don't be afraid to bring your essential oils with you to your massage appointment. If your massage therapist isn't already using them, bring them with you and introduce them to her, because then you're going to benefit, she's going to benefit, and everyone will benefit in the process. So definitely don't be afraid to do that. So that's it those are my favorite oils, and I hope you've written some down, and now you're going and you're going to make sure that you order them up for next month. So let's talk a little bit about acupuncture, which I absolutely love. I've been getting acupuncture for 15 years. I am going to speak to you from a client's perspective because I am obviously not an acupuncturist. But acupuncture it's part of traditional Chinese medicine along with herbology. It is about 2,500 years old, which is really fantastic because in 2,500 years, they really haven't changed anything. Your meridians haven't changed, your acupuncture points, they don't move them to a new spot every couple hundred years, and it works. It's fantastic. So I bet you're wondering, what is acupuncture good for? I could be here all day. So this is really kind of acupuncture and frankincense. Think of it this way. If you don't know what to use frankincense, right? When in doubt, pull your frankincense out. Acupuncture is good for everything. Everything. So traditionally, it's used to treat, prevent, and diagnose disease or disorders. It's based on your energy flow, your chi in your body, and you have these meridians throughout your body. There's a set number of meridians, and your flow of energy. Now, it's believed that when you have blocked meridians or blocked energy, if you have stagnant energy, if there's something else, not moving fluidly, then that's when sickness, illness, disease can occur. So acupuncture obviously uses the little needles and certain acupuncture points to increase that flow and unblock it. There's been some scientific studies on acupuncture. Acupuncture is actually known to increase the activity of adenosine, which is an amino acid that is used to ease pain when there's an injury. Aromatherapy has been around for thousands of years as well, right? So when you combine aromatherapy and acupuncture, you get this mesh of amazing treatment and recovery, hopefully. But it's a little bit different. So I'm going to give you a couple examples. Acupuncture, you want your therapist to actually be using the essential oils and picking the essential oils for you. So I really encourage you to talk to your acupuncturist first. If they're not familiar with essential oils, definitely introduce them, but let them choose, and this is why. So here's an example. Lavender is really spicy and sweet. It's very cooling in nature. In acupuncture, you have your hot, your cold, your fire, your water, your yin, your yang. So it's very cooling, which means it's going to be good for lung, liver, pericardium, meridians. But grapefruit, on the hand, which is spicy, but it's bitter. And so it's going to be warming in nature. So that one's going to be really good for lung, stomach, gallbladder meridians. Do you know this going into? Maybe you do, and great, but I don't, and I would not know. So I really encourage you to allow your acupuncturist to pick the oils for you. So I hope that's been helpful. I am so excited for you guys to continue on this week and enjoy your wellness path, and have a great day.